This is real research, and this research was conducted by the Centers for Disease Control and Prevention in the US, it's the CDC, and Harvard's Center on the Developing Child, which are two of the most respected institutions in child development and public health. What they found is that having even just one trusted adult in their life can make an incredible difference for a child. Research shows that children who have a supportive, reliable adult in their corner are significantly more likely to experience positive outcomes even in the face of adversity. It improves emotional regulation, it helps them build resilience, and it lowers the long-term impact of adverse childhood experiences. If you work in the field of child development or in education or in mental health, you know those adverse childhood experiences are called ACEs, and it has been a huge talking point of all people in our field for the past several years. Having one trusted adult can lessen the impact of all of those adverse childhood experiences. In fact, having a trusted adult reduces the likelihood of poor mental health outcomes by up to 75%. That is massive. And when I first started exploring what it means to be a trusted adult, I expected to find complicated strategies or something that felt unattainable. But I was genuinely surprised by how simple these 5 qualities really are. Here's the 5 qualities just to list them off for you. It's stability, predictability, responsiveness, unconditional care, and encouragement. That's it. Those are the 5 qualities. They aren't about being perfect or having all the answers. They're about showing up consistently in small, meaningful ways that make a child feel safe, supported, and seen. And that's what we're going to dive into today. How you can embody those 5 qualities to truly be the one for a child in your life.